This episode is sponsored by Dr. Chrono by EverHealth, the #1 mobile all-in-one EHR. Built specifically for medical practices, Dr. Chrono includes an integrated feature that powers a seamless payments acceptance experience. Dr. Chrono Payments offers multiple ways for patients to pay as well as insurance credit card processing. As a Dr. Chrono customer, you can easily activate our fully integrated payment solution that will streamline your cash flow and help you get paid anytime from anywhere. Deliver the best patient experience with a fast and easy way to collect payments. Visit drchrono.com/payments. That's drchrono.com/payments to learn more about Dr. Chrono today. A note about today's episode. There is some language that may be inappropriate for young listeners, so please consider this as you listen today. Thanks for tuning in. Direct primary care is an innovative, alternative path to insurance-driven healthcare. Typically, a patient pays their doctor a low monthly membership and, in return, builds a lasting relationship with their doctor and has their doctor available at their fingertips. Welcome to the My DPC Story podcast, where each week you will hear the ever-so-relatable stories shared by physicians who have chosen to practice medicine in their individual communities through the direct primary care model. I'm your host, Marielle Concepcion, family physician, DPC owner, and former fee-for-service doctor. I hope you enjoy today's episode and come away feeling inspired about the future of patient care, direct primary care.
DPC for me is a way to be able to have an open door policy to whoever comes to the door. It doesn't matter if they have insurance or not. It doesn't matter where they come from. Be able to do your best to provide healthcare to them and help them get to their best possible health. So that's my mission from when I started medicine, was to provide care to anybody that came in and asked for my help. So this is the way that I found out that I could do it. And it's been a blessing to be able to do this model and provide care to anybody that comes in through my door. My name is Dr. Buenostro from Buen Vita Health, and this is my DPC story.
Hello, everyone. My name is Carla. I am Dr. Buenrostro's wife. It is an honor for me to introduce to you my husband and read to you his bio. Being born in Turlock, he is now proud to serve the community he grew up in. He is committed to providing high-quality, patient-centered care with compassion and dedication to each one of his patients, regardless of race, religion, and socioeconomic status. He is proud to be able to do this by taking part in the direct primary care movement, which makes healthcare more affordable and accessible. He is the first-generation American, the son of 2 Mexican immigrants. He went to medical school at La Universidad Autónoma de Guadalajara and attended residency at UCSF Fresno Family and Community Medicine program. After residency, he worked 3 years at an FQHC and later started Buen Vita Health. He is an entrepreneur at heart. He has 3 businesses which started after residency. His first business involves 20 acres of almonds, which he highly recommends doing as it grants many tax write-offs. And as we all know, doctors need write-offs. It also taught him lessons in business and how to manage employees. His second business is a wedding venue, and the third business is the DPC clinic. The purpose of bringing up the first 2 businesses is because he feels this was something that prepared him for his dream business, which was to start his own practice. He used to joke around in residency that he was going to do a fellowship in starting his own clinic, which he personally thinks should be promoted. On his free time, he loves spending time with his 2 children, his amazing wife. I promise I'm reading his bio. This is what he said. His amazing, supportive wife. He enjoys playing basketball with friends, farming, horseback riding, and learning more about DPC and how to be a better leader in his office. He is definitely blessed to have the right people around him who have taken part in making his dream come true.
Welcome to the podcast, Dr. Buenostro.
Thank you for having me, Mariel. It's a pleasure to be here. I think it's kind of cool because you talked to me when I first opened my doors and reached out, and I was like, there's somebody out there doing DPC too. So it's always cool to talk to you now that things have been moving along almost 2 years.
Absolutely. And November will be 2 years for you. So it's so exciting. And I remember that day when we first chatted, and it was all because I saw your Instagram post and I had no idea that there was a DPC in Turlock. And so I'm really excited to get your story out there on the airwaves and for people to know what, care is like in your neck of the woods. I want to open with the fact that you are practicing in your hometown. So when you shared in your opening statement about how your mission that you always wanted to fulfill in medicine is really coming to life in your DPC, what was it that made you want to practice in your hometown specifically?
So I think that always was my dream, is just to come back home and provide care where I came from. So that's always been my dream ever since I started, was to come back over here. And it's kind of crazy. I wanted to be a doctor since I was a little kid. My elementary teachers always go, "Oh, you always said you want to be a doctor," and type of thing. So it was funny because in high school, I met a doctor. His name's Dr. Rubalcaba, and he's an attending doctor at the UCSF Fresno program. And I grew up Catholic, and my mom knew the priest, and he knew his family. And he said, "Hey, you should connect with him because I know he wants to go to medical school, and it'd be cool to talk to him, and so that way he could kind of guide him or give him some advice." And we went over there with my parents, and I met his family. And man, he was they're out of Houston. I don't know if Houston is a small town close by here. And I saw my family there. I saw his parents look like my parents. They were humbled. The dad worked in the fields. His mom was really hospitable when we got there. Brothers and sisters were out there playing in the yard. They're having a barbecue. And he was really nice. He's like, "Hey, yeah, you could do it. You could be a doctor." I went to Stan State here in Turlock. And then I went to Autonomy in Guadalajara. Right now I'm in Fresno doing my residency. And if I could do it, you could do it. And that kind of lit up more fire in me to be able to follow him. And he was my mentor. I only applied at one college, which was Stan State. I only applied at one medical school, which was La Autónoma. And then I applied to 2 residencies, actually, which was Modesto. I think you interviewed me there, which is kind of funny. But I know you interviewed me. I was like, I think I have a clear picture of you interviewing me in my head. And then I also interviewed at Fresno. So Fresno was my number 1. And then you guys were number 2 in the match. And I mean, I don't know how things were going to line up with the match. It's crazy. So I got picked. I put them number 1 and they got me on. So I went over there. And you guys were great in Modesto. So I remember getting some calls from some of the residents, like, "What the hell? Are they going to go over here?" And I'm like, oh, I felt bad. But he was my mentor. So I was so happy just to be there. And, he when I graduated from residency, he said, "Man, this guy's like my mini-me." He followed me through he went to college where I went. He went to med school. I decided to stay here as an attending. But, when I first did this, I thought I was going to go back home and serve my community where I came from, but he's going to go back and do that. And that's what I did. And it's been cool. It's been cool to be back home and serve the community I grew up in and serve some. I mean, I have friends that I went to high school with have kids, and they bring them into the clinic. And when they say, "Hey, man, it's really cool to see what you're doing," and it feels good, and it's humbling. It's humbling. And we try to do things like I do free physicals for like all the football kids from Pee Wee, and then I do all the physicals for some of the wrestlers because one of my good friends is the wrestling coach. So I do free physicals because that's one of the things that Dr. Rubalcaba kind of was doing out there in Fresno. We would go to the high schools and do free physicals. So it's one of the things that I really enjoyed doing, going out there and doing that. We did it once or twice a year. And so when I started to practice, I started to hook up with some friends and that were out there doing like coaching football. And I told them, "Hey, if you need help, let me help you guys out. The kids need physicals. I'll do them for free. We'll do one day from 12 to 4, bring them in and we'll take care of them," and that kind of helped to spread the word too with the clinic and stuff like that. So it's a win-win. One, because I like doing it. I played baseball and I played sports. So for me, it was one of those things that was important because sometimes my mom had trouble taking me to get my physical, or I don't know, things might have been tight. And maybe they were like, sometimes like, "Oh, I got to pay $100 for this physical again." So it's cool just to be now, every kid should be able to play their sport. And it shouldn't be because if they don't play, it shouldn't be because they can't get a physical. So That's some of the things that we did. Yeah.
Awesome. And I love it because, just like there shouldn't be any kid who can't play because of a physical, there shouldn't be anybody who is told that they can't be a doctor, right? So I think that that's amazing. Just going back to your story with Dr. Rokava, to have that special meeting and to have a special mentor like that. And absolutely, my husband used to work in Houston, so I totally know. And for the audience, it's a very small rural farming type of town, very close-knit community.
Close-knit, for sure.
Yeah. Yeah. So this is incredible to take your story again on the air, and you don't know who you're going to inspire by sharing your story. And I love that just your little nuggets there of how you've been incorporating yourself into the community as the community needs. I think that's so amazing. And whether you're from the spot that you're practicing DPC in, or you've just moved there, you become part of your community because you're practicing relationship-based care. So incredible. Now, I want to ask you on that note, how did you even learn about DPC and decide to get started in your clinic?
So it's kind of crazy. I worked in the clinic out in Atwater. And like I said, my mission was open door policy. So when I went out and interviewed, I actually interviewed in Modesto. I talked to some of the faculty there. I came back home and I just started interviewing with the locals. And then one of my cousins, his wife now, anyway, she was working there as a nutritionist at this FQHC lookalike practice. And she said, hey, check out this place. You think sounds like kind of what you want to do. So I went out there, interviewed with them, and it was cool. I enjoyed working there, the patients, and I enjoyed the people I work with. But the thing that got tough as I was there for 3-4 years was that the overwhelming just load of patients that I was having. I was seeing up to 40, 45 patients in a shift, so 10 to 12 hours. It was a heavy load. And I'd never practiced fast medicine. I always took care of each patient. So I was at the end running an hour and a half, 2 hours behind. Luckily, the patients liked me, so they were patient with me, but I didn't feel it was fair, So as I talked to them about changing some of that culture, they would nod their head and say yes, but nothing would change. So I think I'm an entrepreneur at heart. My mom's a big entrepreneur, and I look up to her. She worked in foster farms here for a lot of years. And then she branched out to start her own travel agency. And then they started buying land and did farming. So that kind of influenced me to take my own path. So that's kind of how I initially started working at this clinic. I got overwhelmed. And with kind of tying back up into like my mom, I always wanted to do it, right? So the way it kind of just started, the ball started trickling was that I had my baby girl. I have two kids, so my baby girl was born. I had bought a ranch, 10-acre ranch of almonds in Delhi, and the real estate guy that I did my deal with, we became good friends. Awesome guy named Heido. Shout out to Heido because he's been a part of this journey with DPC because he's the one that found my place where I practice now. So what happened is he came over when my daughter was born. He's like, hey, I'm going to come over and we're going to bring you some food so you guys don't have to cook, and just great guy. So when they came over, the way I am, he came over like just to drop off the food. And I was like, nah, you got to stay and hang out. Let's chill. So he was like, nah, I just came. This is all about you guys. I'm like, nah, come in. So he came in, we ate, we made some bomb food and we were hanging out. And he's the kind of person that he's very, passionate and very positive, and he's always aspiring to do good things and do great things. So we kind of feed off each other. And I was like, man, I've been working for about 3-4 years and I got to start my practice. I want to start my practice and I got to do it. And he said, oh, okay, so what are you looking for? Like, where you want to be? Whatever. And I told him, hey, well, I want to be in Turlock. That's where I grew up. That's like my home base. And I had a strategy. I even went out to Atwater for that reason, because I wanted to be like enough far away I already heard about these claws and all this bullshit. So I'm like, it's not too far away, but far enough. So anyways, the whole thing was that once I told him, like right after that, like the next 2 days, hey, I found a place here. I found a place there. We went and looked at these places and I'm like, now I started feeling real, right? Because he started taking action. And I'm the kind of guy that I go with my gut. So if I feel it, I'm going to pull the trigger and let's go. So we went and looked at some places, but they wouldn't line up because you had to build them out and all this stuff. And it was like, okay, maybe this is not the right one. And he's the kind of guy that wants the best for you. So he's just like, yeah, I'm going to keep looking. He's not looking for that dollar. He's looking to make sure that you find what you're looking for. So anyways, all of a sudden he's driving by this building and it's on the corner of Colorado and Tuolumne. It's right next to the hospital and it says like for lease, right? And so he hits the guy up and he says, hey, like, we're interested. And I said, hey, like that place looks perfect. Like bug the shit out of him. Like tell him like we want to see it. Right. So actually we were the first ones to go see it. And we walked through the building and the guy's name's Mark Mott. Shout out to Mark Mott because he's made this dream come true for me because he gave me the opportunity to rent this building out. Now, when we walked through the building, he told me the story. His wife they actually opened it together because he was construction and she was a chiropractor. She was practicing, and then she wanted to open up her own practice, and he helped her take this commercial building, turn it into a practice. So when they built it out, she had a great practice and it was doing great. And then she got hit with cancer, with breast cancer. Pretty much she fought it for like 5 years, and the cancer finally won. So she passed away. But Mark told me so many great things about her, and everybody that I've run into that know her always speaks very great about her. So pretty much when we went through the building, he was telling me the story about how they built it out and how that period of time in his life, and you could tell he loved her with all his heart. So he really wasn't about making sure somebody didn't come in and want to take out fault walls and mess up his building. And the building was perfect for me. I told him, hey, this is what I'm looking for. There's 3 rooms, and that's all I need. The only thing we're going to do is change this carpet because it's pretty old. But other than that, I think everything's is good. And then he shook my hand. He said, all right, you want to lease it out? And then I said, yeah. And he said, okay, you got it. How long you want to lease it for? I'm like, I don't know. Like, what I've never done this before. And I said, what's normal? He's like, 5 years? Okay. So we shook hands. He said, okay, I'm going to call the other 15 people that were going to come today to look at the place and tell them that it's already done. We got a done deal here. And yes, as he was telling me that story, my wife was there and I was there with my 2 kids. And he said, you know what, you just kind of remind me of me and my wife just starting off, and I want to give you the building. And you don't see that no more. You don't see people do that no more. You don't see people just shake your hand and make a deal and cheer for you, not knowing me. He was cheering for me, and so we're friends now. So sometimes I have a ranch and I have some cows and we go out there and I invite him out there because my dad loves milking fresh cow milk. I don't know if you ever heard about that, but my dad loves that. So he's a country guy. So I invited him out, and he's like, Nach, I thought you were crazy when you told me that you weren't going to take insurance and all that, but something about you, I believed in you. He said, you're lucky your wife and kids, but just all that together. So anyways, it was just that the thing that I'm like, man, he could have been reading it out to somebody else, getting more money or whatever. I think he was really fair, and I think he values friendship and getting to know somebody. And now all his family is my patients, all his family, his kids, his everybody. So it's a cool thing. It's a cool thing that he gave me that opportunity.
That's so incredible. And I really love, though, that you highlighted how you went with your gut, because I think that's a really important piece for people to listen to and to pick up on, because whether they do or they don't follow that, if the listener is potentially looking for a space to grow into with their DPC, not only looking at the terms of the lease, but also like thinking about, am I feeling anything that makes me hesitant to do this? If you're deep down having some second thoughts, it might be a good thing if that place falls through or whatnot. But I love how your story ended up in your practice and this amazing place that's right across the street from the hospital. So congratulations.
No, thank you. And I think to add a little bit is I pictured a place that was, like I told him, I came in my picture, I said, hey, Mark, what I'm picturing is I want this to be like a home. Like when you go into your home, what's the first thing you see is just pictures of your family. You have your nice couch or a chair that's comfortable. So that's what you see when you come into the practice. That's what you see. And on top of that, when he shared his story about his wife, I believe in, like, my grandma passed away early, but I got to know her. I feel like she's looking after us like an angel. And I believe in that stuff. So I believe that we continue to try to make these people proud, even though they're not here. And his wife, I really felt that she was there just through him and the sharing that story. And I felt like she was such a great person that was doing the same thing that DPC does, which is trying to provide care to the community. And her as a chiropractor, she was doing that. She was doing that for people that if they couldn't pay for something, she would help them out. Or she would just make sure they were able to get it. And just really wise words. So I asked him, hey, is there any way I can have a picture of Karen? And then can we put like a little, because of breast cancer awareness. So in the waiting room, Karen's there with her picture, and there's a breast cancer awareness. And there's some awesome quotes that she used to have a journal and write, just words of wisdom that she would always kind of write down and pass on. So those things are in the clinic, because I like to tell the story of the clinic. And then like in the hall, you have the first picture with like Mark and Heido, which is a real estate guy that when we shook hands, that picture's up. My buddy Romel, his family, his picture's up. And everybody that's involved in the clinic, their picture's up there. So it's not only our pictures, but everybody that's involved. And that's kind of the idea, is to share the story of the people that are involved in the clinic.
Stay with us. We'll be right back. Thank thank you to Spruce Health for supporting the My DPC Story podcast. The ways we communicate have changed dramatically over the past decades, but technology and tools in healthcare have not kept pace. Patients want more access and digital convenience, as well as the ability to text their care teams. Care teams are inundated with more communication and rising expectations, but are still using tools and technology stuck in prior decades. Spruce Health created a solution for the tech-forward DPC practice by creating a communication product designed to serve both the patient and the doctor through intuitive HIPAA-compliant workflows, tagging, scheduled messages, and triage templates ready for use, whether you're on your phone or in the exam room. New users get 20% off for the first 12 months of a paid plan with code MARYAL20. That's MARYAL20. So check out Spruce Health today at sprucehealth.com or check out the link in the show notes. So cool. So cool. Now, I want to ask, when you were dreaming about, hey, I want to have my own practice, I want to follow my mission of having an open door policy, when you found this building and this amazing space with an amazing history behind it, had you at that point decided that you were going to do DPC, or were you looking to do a fee-for-service clinic?
Yeah, I just had an open door policy in my head, but not DPC came right in that moment. I can't remember if it was like we already had it like in mind, but what happened was that it's kind of crazy because I have to backtrack to really make sense of this. Is that so when I moved to that where I lived, that ranch, that 10-acre ranch, there was a neighbor that lived behind me and he had a ranch for sale. Okay. And I went over there to try to buy it because it butted up against the other to make it like 28. He's like, nah, this is already sold, but I have another property over by the river. So I said, oh, well, that'd be good. I'd like to check that out. He's like, well, if it's for sale, I'll let you know. We'll go check it out. And I think I'm going to sell it. He gave me a call like 2 months later and we went over and I ended up shaking hands with him and buying that property. And I made it into a venue for weddings. And that was my first, Almond Ranch was my first kind of like entrepreneur kind of thing that I was doing. And then I made that into it's been 5 years that we opened up that venue, but that's where Romel comes in because Romel was my good bud. So he was the one that I'm like, hey man, like I'm doing this, I'm doing that. And he's a CPA, so he knows the numbers. So I had pretty much I was trying to do all this stuff. And my wife one day goes, hey, you're missing a lot of time with Roman. He was a baby and I was working, like trying to go to work at my job and then trying to balance this farm and then the venue. And I was leaving early and I was getting home late. And then my wife, I go, hey, we're just starting. I need a hustle. Like I want to do this because you barely get out of medicine. You start making a little money. Now you're trying to do something. But she made me reflect. She said, we don't have to do this. You're choosing to do this. So you're choosing to do this and you're losing that time with your son. And she made me reflect on that. And I think that's where DPC really connects with me because that's what DPC I wanted to do with it was get my time back. So what happened was that when all that happened, I didn't know anything about payroll or how to keep QuickBooks. So Romel came in and I hired somebody that has been working with me for 5 years. And he does all my maintenance on these properties. But Romel does all the payroll and he's already doing all the QuickBooks. So when the DPC came, we were ready. And it was like amazing because we didn't feel green. Romel's like, oh, dude, I got you, bro. Like, okay, what are we gonna hire? We're gonna hire the MA and I got their payroll. All right, this is how we're gonna organize the business. We had to open up the corporation, of course, and all that. But he kept all the QuickBooks and all that. So I was free of dealing with all that. And then he would keep me in the loop, like, hey, this is what the expenses, this is how we're doing, this is how many new members we have. So we meet once a month and go over that. But it was cool because the transition of what happened led to DPC actually being really successful and smooth because we were already like, didn't feel green and scared. Now we were like, bring it on. Like we could do this. So Romel's like my CFO. He's like the guy that does all the books. And we have a dream that he's going to come on. Like he's been working like for Gallo and he's been working for them for a while, but he also wants to do his own things, but he loves the numbers. So I'm like, man, if I could get this going big enough or get more DPCs going, because I think that's our mission is to get more doctors involved, but maybe I could be part of them, helping them and in whatever way, I honestly, I listen to DPC story and I tell him, Romel, you just call these doctors and tell them to run their books and tell them, get everything. I'm sure they're going to love you, bro. Like, honestly, that's what makes me like really happy that I don't have to like don't have the stress of that. So the backstory is that all these things led to the DPC, and Romel's the one that found DPC. He's the one. So I'm like, okay, Romel, we're gonna do a cash practice because I don't want to deal with insurances. I don't want to deny any patients from coming into the clinic, and I just want it to be simple. You know what I mean? And then he started looking at YouTube, and he found Josh Umber. And Josh Umber started. Josh Umber's he could really explain things in a really logical way that makes sense and makes you laugh. And he makes you want to like follow him, right? So he has that. So he's like, dude, check this out. Dude, this doctor's talking about kind of what you want to do. I'm like, what is this DPC stuff? And I listen. I'm like, man, that makes sense. That makes sense. You get everything at cost. How do you get that? He's like, oh, just call the Quest people and they'll set you up. And how do you get medications? And I pictured like a pharmacy, all these huge, it's a little cupboard you got to carry. That's it, And so Romel said, hey, Romel's like, hey, I sent Josh an email and he's going to talk to us on this day. I'm like, for real? He wants to talk to us? I'm like, for real? I'm like, okay. So we talked to him and he had a glass of whiskey and he's like, hey guys, how's it going? And we just started talking and he told us about the EMR. He told us about Atlas. I didn't know anything about that. And then we started telling him like what we were doing and everything like that. Same thing like Dr. Rakawa. He just really made me feel like, okay, cool. Somebody's giving me like that. This is the right way to do it. And then from there, we just followed his. Like I always have a saying, if it's not broken, don't fix it, right? So he gave us the numbers on what he was using for some of the patients on charging. He broke it down on how you try to just make sure everything's like pretty much really affordable and cheap for the patients when it comes to extra stuff. So that's what we try to follow, just that blueprint. And it worked out, it worked out perfect. And then his dad was cool, man. I called his dad a couple of times because my place I was working at tried to sue me. So I called his dad and he helped me out on like what to do or whatever. So, but it's kind of crazy because I'm trying to connect the dots. Steve Jobs says you can't connect the dots forwards. You can only connect them backwards. So I'm looking back and going, okay, like if this didn't happen, this didn't happen. If this didn't happen, this didn't happen. And it all kind of lined up. But I've had a great team from shout out to my wife that's been really supportive, Romel that's been like on top of the books, and then all my staff that just makes this clinic run really well. But really it's like certain things I've done have led me to where I'm at right now with this practice. And Romel's the one that found out about DPC. So I just pulled the trigger. I'm like, this makes sense. The worst thing that can happen is I just go to insurance-based stuff if it doesn't work, and let's just take off with it,
Love it. And yeah, I think that if it doesn't work, you're still going to be a doctor and you're still going to move on and still, if you have family, you're still going to be part of the family and it's nothing to be ashamed of. I absolutely go back to Dr. Whitney Webster Pack, who said, if it doesn't work or if it does, no matter what, you've done this out of love and you've done this out of wanting to be the doctor who you want to be and serving your patients the way you want to. So on that note, I want to ask, who has joined your practice? Who has found Buen Vita Health to be the clinic for them?
In regards to like patients, I think it's just everybody from the community. Well, how it started, like when I talked about my mom, she gave me the blueprint on how to transition to opening up your business. Because like I said, she worked for Foster Farms. And this is a story that I have to tell because I think some people have a hard time shifting because they feel like, oh, I can't do it because if I do it, then how am I going to cover my bills or how am I going to do this? So my mom, when she worked at Foster Farms, she was climbing up the ladder. She's always been like the kind of person that wants to keep on learning and keep on climbing. And she came from a generation where as a female, they wouldn't allow her to go to school. So her mom and dad didn't let her go to school because she was a girl. And then when she got married, my dad didn't really support her going to school. And she always wanted to learn. So when she worked at Foster Farms, she went all the way up from the line, which is just the hardest work, to quality control. And then one day when she tried to get another position that she was qualified through her experience, they gave it to somebody else. And then my mom tells a story that she says, when they gave it to somebody else, I talked to the guy, the manager that was going to give this position, asked him, hey, why didn't I get the spot? And then he says, well, Martha, if you don't have a degree, you're always going to be cheap labor. So that like lit up a fire in her, like, oh, screw you guys. I have more value myself. So she opened up a travel agency. So when I was a kid, I'm the oldest. She would work at the travel agency during the day, and then she would go to Foster Farms at night. She did that for like 2 years. So I grew up in that travel agency, like with her every day. And I remember helping her sell tickets. I started learning, and I was doing answer. And that's the thing that's cool as a teacher. I learned how to answer the phone. I learned how to talk to customers. And that's part of my DPC too. Like I already knew that, right? So that came easy to me. I didn't feel like it was foreign, and I knew how to give the customers options and how to greet them and how to make them feel like, they're your customer, you're taking care of them. So to me, I'm grateful for that experience that I got from there. And I'm also grateful because that's the same thing I did. I saw her do that for about a year, 2 years to get to where the travel agency took off, and it's done great. She's done that for 16 years. And it's like she did it through that transition, and she never let her family down because she was always making sure that the family was taken care of before she can jump to just doing it full time. So I worked at where I was working at 12-hour shifts. I did Monday, Wednesday, Fridays, 12-hour shifts. And then I would work Tuesday, Wednesdays, and then Saturdays at the clinic. So that's how I kind of build up the practice. And it was crazy because that was in November and my contract was up in July. So I was like, all right, I don't want to sign another contract. So hopefully in July, hopefully everything lines up, right? So I got on a radio show that's in Spanish, and it's a radio station called La Favorita. And there was this guy named Explosivo that would go on live. So I would go on live and talk to him. And then pretty much we just put DPC out on the radio waves, like, hey, this is Dr. Buenostro. He's doing DPC. And then he would, the same thing we're doing, like, hey, what's DPC? Hey, anybody can come here. It doesn't matter if you have insurance or don't have insurance. We can take care of you. We're going to get all the labs for you at a cost. We're also going to do any procedures, you can get them at cost so you don't end up in the ER. So we would have this radio show. And as soon as I was done with the show, everybody would be calling. And the phone on the clinic every day, like 10, 12 calls and appointments coming in. So that kind of how it started. And it's crazy because I got people from Sacramento, Stockton, because that radio's all over. And I'm like, how are these people driving all the way over here? And they're still our patients, and they're happy. They're happy because they can call me and I could send them medication with something simple. And I guide them if they're not getting better. And then if it's something in person, then they come in and I'll take care of it in person. So it's crazy. But that radio show really kind of took off and helped. But see, here's the thing. Then you're looking at the return on the customer acquisition cost and the return on your investment. So the radio was pretty expensive, but it was worth it. It was worth it. So the thing is that then what I found out is like, well, how can I get my customer acquisition costs within the clinic, right? How can I get them to, when they come, to either like one stay, but then also get me more patients? So what I did is I charged $100 to sign on, but I included all their labs in that $100. So there's like, $100 and I get all my labs. Dang, that's a sweet deal. And then they would sign a contract for a year to be members. But then after that, then I would follow them up for preventative care. And they would call me up all of a sudden when something else was going on. And they would spread the word like, oh, there's this great deal. You pay $100 and you get all your labs included. And he's going to explain everything to you. And then if you get sick or anything, you call him and he doesn't charge you extra. So they would spread the word. Like, so after you got like 100, 200 members, like it was all of a sudden, everybody was, my friend recommended me, family recommended me. And we just kept hearing that. So the radio, by July, we were already good. I was good to quit, but I had to stay extra 3 months. And I'll share this with the doctors because I'm a man of my word. So if I say, hey, I'm going to do this, I'll do it. So my contract was up. I said, hey, I'm grateful for everything you guys done for me here, but I'm going to be taking off. Thank you and peace out. And I had told all my patients where I was too. So if they want to roll here, they could come to the clinic. So they had something called an evergreen contract. So they said that even though I didn't sign anything, that the contract would renew on its own. And I was like, that's bullshit. So I said, look, I'll give you 30 days and I'm out. But they said, no, you got to give us 90 days because that's what the contract says. If you quit, you got to tell us 90 days. If we fire you, we got to pay you for 90 days type of thing. So I was like, man, that's some BS, right? I was like, I'll give you a month, but I've never heard about somebody quitting 90 days later. So anyways, they put the dogs on me. They called the lawyers. I got this card. Supposedly it said that I made the clip. And this is where it opens up your eyes. You're like, it said that I made like, I don't know, let's say, I think it was like $130,000 a month for them, $130,000 a month. So they would sue me for $130 for every month that I was going to be gone, right? So you're talking about $200,000-$300,000. I'm like, it's not worth going through getting lawyers and all that. Okay, I'll just stay and let's sign something that says I'm out by then, and that's it. So it's always good to always say, if you're going to do a contract, make sure that they say every year I have to sign it in order to renew it because it's worth it. And then always make sure that if there's that 90-day thing, that it says that maybe if it's past your end of the contract, that it doesn't count, like unless it's within the contract, because you have to do that. You always heard about that in med school, like look at the contract. And I thought it was a simple contract. And then all of a sudden they did that, but it worked out. Everything was fine. But it just goes to show you that they didn't really care. They're like all about just their numbers and that's it, So then it made me even feel better when I did the deep. I'm like, I'm so happy that I'm doing this and that nobody can do that to me anymore, right? Nobody can push me. Nobody can tell me what to do or how to do it. And I'm going to do my best for my patients. Yeah.
Absolutely. And the evergreen contract is definitely something that corporations have tended to put out there more so than they did in the past, because realistically, it takes a lot less time for one contract to be signed and negotiated, and then that's done. But there are so many issues with that when it comes to physician autonomy, physician value, and then the fair compensation just totally is at risk there with any evergreen contract, in my opinion. So that's amazing how getting on the radio and not only just looking at the patients, but also the costs that went into that. Of the patients who have joined your practice, how many people are younger? How many people are older? How many people are insured, uninsured? Can you give us an idea about the demographics of your practice?
Oh, man. Our EMR doesn't really like pull that in regards to exactly, but I'll say it's above 44 years old. I think we have probably, because we're getting close to 800 members. So it's getting really busy. And I have a nurse practitioner that I'm training right now to help me out. And I'll tell you guys about that story in a little bit. But pretty much, I think it's maybe, I'll say it's even. I have a lot of young patients because I can't give exact numbers. I have a lot of young patients under like above 18 and 44, and then a lot of patients above 44. So, and a little bit of the under 18, not a lot of members, but a lot of families sometimes have their kids and they want to get them on because it's easier to contact me. It's easier for me to send them something. It's easier for me to get them in. But for the most part, it's mostly 18 to and above. That's the patient. Yeah. But the way I could put it is Romel says, hey, the average on what you're doing per patient is like $67, $68. So if you take the $50 and the $75 people and you put them together, it's like about 60 something. So I don't know if that tells you anything, but it does. That's what it averages out.
That works. Awesome. And in terms of the enrollment, when you chose to do an enrollment fee, what does that help out with in your practice in terms of, does it pay for administrative costs for the start of obtaining medical records? How does it help your practice? Stay with us. We'll be right back. Have you tried an AI scribe in your clinic? Well, I've tried so many, and I can say Heidi Health is the best AI scribe I have come across thus far. With Heidi Health, I can create unlimited customizable templates for my notes to help me truly cut down on the time I'm spending charting. Template for pediatric well child check? Done. Template for weight loss management? Done. Some of my favorite things I've built into my AI template, beyond the general soap note, are having a list of actionables for our team to take after a patient visit, having the diagnoses listed, and creating an after-visit summary for our patients. Not only have I found Heidi Health to be the most helpful, customizable AI scribe so far, it's also more affordable than most out there. So try Heidi Health today and see how you can harness the power of an AI scribe for your practice. To get an entire month of Heidi Pro free, go to the homepage of mydpcstory.com and click on the Heidi Health ad.
I like to keep it simple, and I'm going to go back to Josh Umber, and I'm grateful to talk to him, and thank you again for sharing, keeping it real. He always keeps it real, and I think that's sometimes what we need, right? Because a lot of times that's what we're talking about. When we work for a corporation, sometimes you feel like you're not, like you don't know if you're just a number or whatever. So with Josh, I feel like that's kind of when we connected. He made it simple. He said, look, what you want to do is get your members And then once you get your members, that's your honeypot. And to that reflect, I'm like, oh, okay, that kind of makes sense. So your goal is to try to reach a certain amount of members, so that way you could stay afloat, pay all your overhead, pay yourself, and then maybe be profitable as a business owner. I mean, that's kind of, I always tell myself I'm the doctor and then I'm the CEO, right? So then I try to get those two things separate. So that way I can kind of, in my head, I think about, okay, what are we doing as a CEO and what am I doing as a doctor in the clinic? Because as a doctor, I want to focus on my patients and I want to stay focused on that. And as a CEO, I want to stay focused on the business and how we can make it grow and make it better and make it the best as possible. So the way I look at it is my goal from the beginning was to quit my job. And I said, I always tell people, if you're going to open up a DPC, you have to set your own goals. But for me, my goal was I want to earn as much as I'm earning at where I was working. And I want to have as much vacation as I was having at my old job. But hopefully I get more time. That was my goal. So putting those landmarks, then my goal as I was working in Castle and I was at that other clinic and I was also doing my practice those 3 days, I was just trying to build my patient panel, right? So I could quit and then just go there. So I like the way Josh puts it, just the better you make it, the more juicier it is, the more value they have in it pretty much, then the more they're gonna like say this makes sense, right? So for me, that's what it was about. It wasn't about covering anything. It was about them staying on with me. And I knew that once I started seeing them, that they were going to want to stay on because we were doing everything so much better than everybody else. And so that's what it was. This is one thing that might help somebody. So it's $300 to sign on, okay? But that's only if you don't sign on at the first time you come in. So the first time you come into the clinic, it's $100, and that's the first time visit. And the $100 includes your labs. The labs for me cost me for basic labs, the basic stuff, CBC, TSH, LDL, we all know the basics for like a physical exam, is about $35. So maybe I was making about $60 on that visit. And that I was just hoping that visit would cover the overhead and just keep the clinic open. But then from there, we have a member that now is going to sign on for that year. So we know we can count on that. So I wasn't really counting on like them signing on and getting that. I was counting on them just coming on as a member. But then if they didn't sign on because they were like, oh, I don't know, and this and that, that's okay. But then next time you come, it's $300. Like they only get a one chance for the $100. That's it. And you only get a one chance with the $100 with the labs once. And then I have a great Nacho's my MA. Oh man, he's an awesome guy. So he's the guy that makes my life so much better because he's the one that takes care of all this. But he's the one that tells them, hey, if you get it today, you get it for $100. You get your labs included. And then if you don't, then what's going to happen is that next time if you come back and you want to do the membership, it's $300, right? So really save a lot of money right now. So those $300 can pay for 3-4 months of your membership. So once they see it like that, it's like, okay, it makes sense. And then you see them and then it makes total sense after that. So that's what I would recommend. For me, as a CEO of my business, I say that's my customer acquisition cost. It costs me about the loss of the $35 for the labs is what it cost me to get that acquisition. But then now they're going to do the marketing for you because now they're like, man, there's this place. You go $100, include your labs. And then the doctor explains everything to you. And now the other day I had a cough and I called him and he let me know it was allergies. Or he let me know it was an infection and gave me antibiotics and I feel better. So they spread the word for you. So that's your marketing, the word of mouth. Because if they go and they go, oh, it's $300 and it's so expensive and oh my, that's not what you want. You need to make a good first impression, So as a CEO, that's what I was trying to shoot for is, what's the experience from that patient coming into the front door, my staff greeting them, making that experience so like the EMR, a lot of people they can't get them to go online and say, no, come in, we'll take care of all that for you. So they help them just get it into the system, make it simple. Because a lot of my patients are Hispanic, they're old school, some of them, and they don't know about that. If likes that, then they can do it. It's there. But we try to make sure that if they come in, we'll help them get all that squared away. So all the forms and all that. And then from there, the MA tries to get them in, take their vitals, make sure they ask all the questions, be hospitable. And I teach them that. Treat them like it's your mom and dad. Treat them like it's your family. Never forget that. And I repeat that every morning. Every morning, remember that we're here to help them like it's your family. And then once I see him and everything, then Jose, he's the one that then goes and gets them to go to the back. And he's going to get everything ready. He's going to give them their meds. I taught them about the medications, which I already explained everything for them in the room. But then he says, okay, this is your thyroid medication. It's for 3 months. It breaks everything down. And then he breaks everything down on what they're paying. So that makes like, okay, that's what I'm not going to get a bill later on, right? No, everything's right here. This is what it is. So they leave and they're like, wow, they never got a bill later on. And then that's the experience they're having. And they're sharing that with everybody. So that's what DPC is. And once you focus on that, man, it's just it grows so fast. You know what I mean? And that's kind of what I've been trying to do with DPC is just make it the best as possible in regards to experience to the patients. And it's worked, you know?
Awesome. Now, in terms of, you've been talking about Jose, you've been talking about Romel, and you've been talking about, and I love this because this is my DPC story. And so I'm all about stories. Can you share with the audience who exactly is on your team and just go over their roles again? And can you share how they came on board at Buen Vita Health?
Yeah, so talking about the team, I feel so blessed and responsible for, everybody that works for me. And I think that's one of my missions now. Like, med school was one of my missions when I was being young and choosing a career. You think that, med school, that's the thing, right? But now that all that's over, it's like, what's my mission, right? And DPC, I think, gives me all that back, right? That why we went to med school to help people, but also the employees. Like, to me, that's the people that I'm responsible for. And I want to try to give them as much as possible because they're the ones that are helping me. So looking at that, I'm going to go backwards too. The venue has brought a lot of the success to the DPC through different ways. One of my employees, it's like my best friend, like I call him a brother. His name's Giovanni. And he's the one that I told you when I was trying to do everything by myself. He's the one that came on. And then now he's like my right-hand guy when it comes to all the construction stuff, the maintenance stuff. So he does the stuff on the venue, but he also does the maintenance on the building. So he does all the landscaping, cleaning the yard, keeping everything clean. Inside, he did everything in this. He did the flooring, he did the baseboards, the painting. He made it look how it looks now. And that's what people love, that welcoming feeling. And we worked on that together. He's the kind of guy that I say, hey, this is my idea. And he's like, oh, I got you, bro, let's do it. So we work together, So to me, that's giving me success because that's what's hard for a lot of doctors. It's like, well, how do I get this place off the ground? How do I make this place work? And he's given me that, right? So I worked at Home Depot when I was young. I know all the materials and all that. So I'm blessed to that experience before college and med school that I know all that stuff because I go get all the materials, bring him in, and then he takes care of all the work. And then if he needs a hand, I'll give him a hand. But, that's the building itself and the maintenance. Gio's the one that takes care of that. So that's where it's a blessing for me. He's worked for me for 5 years now. And I really try to take care of him. It's his birthday. Hey, let's go have a birthday party. Invite all his friends and I'm throwing the party. Try to give him a raise, and take care of him every year, looking at how I can make things better, vacation, all those things. And he's a single dad. So the way we work is your daughter comes first. So if you have to go pick her up, go, and then you come back and keep going. And, I believe that you don't need a manager. You don't need a manager. Managers is just a waste of time. Everybody knows what they need to do. We're all grown-ups. So if you build a team that they know what they need to do, then that's the key, right? Because if somebody you have to be looking after, then it's not going to work. So Gio's that kind of guy that we know what we need to do. He gets it done, and it's a win-win. With Jose, he's my office manager. He's why DPC has been good because he's so good at just taking care of the patients. He's so patient, he's so kind, and he has everything to be a doctor. So I try to get him, hey, go to med school, be a PA. Like, you could do it. Like, you got the right things for that. But his story is that he worked at McDonald's and he's my cousin. So his dad had bad diabetes, got dialysis, and next thing you know, he was helping his mom to take care of things at the house. So he was kind of stuck, after high school, just working to help everything keep afloat. And on the weekends, I had that venue, right? And he was helping me on the weekends do security there because I have him watch out at the venue. And I just saw all these qualities in him. He really cared when he was there about how things were going and welcoming people. And I was like, man, on top of being my cousin, I was like, man, he has everything for better opportunity. So when I opened up the practice, I said, hey, why don't you come work at the clinic and you can work in the front, and then once you get your MA license, and then you could do the MA, and then I'll take care of you. And right from the beginning, I thought about the things I hated at Home Depot and all that. And like, dude, like when you were there, they gave you like 10 cents raise, and they didn't give a shit about about you as an employee. So I said, I'm going to change that. So the way I do it is like when I hired him on, I said, hey, I'm going to pay you this much, right? Like, let's say whatever, $16 an hour, whatever you're paying your MA. But every year I'm going to raise you $1, okay? But I'm going to cap you out at 20 or whatever cap. And if you want to grow more than that, then I'm going to say, hey, there's this more position, but you, whatever way to keep them growing. And that was my mission, to help them feel like I could keep growing and they know what to expect every year. And that dollar, I say, all you got to do is show up on time, not miss any days outside of your PTO or vacation, and then just not get any big complaints from the patients. If you did something like you lost your temper or something and redo it, then that's going to nick you. But if you keep all that in line, man, I want to give you that dollar, you know? So nobody gets like $1 raise, right? No, not a lot of places do that. So that was my goal, is like, let's help them keep going, because why have somebody quit and go somewhere else for $1 that they gave them more? That's just dumb, right? And a lot of people do that. Oh, they gave me $1 more, so I went over here. So to me, I was like already thinking about all that stuff. And then I wanted to help him with his MA. So for me, like I gave him the side job at the venue. So he was working for me full-time at the clinic. He would do that side gig and he paid with his MA for that. And I tell him, hey, go to school. Like, he's not married, so I go to school and I'll help you out. I'll help you keep growing. And I say, become a PA, nurse practitioner, whatever. And hey, let's open up a DPC. I'll help you do that, whatever. So I'm all about helping. I think that's my mission, is to help out. And now I have another person that's not an MA. She does the front desk fully. And I have an MA that she kind of does the MA role. But in my clinic, I want everybody to know every position. So as they start, I want them to master like their original position they got hired for. But then after like 6 months to a year, I say, okay, now you're going to learn the front. And then as they learn that, then I'll give them a raise. And then that way they keep growing. And if anybody's sick or not there, we could run the clinic with just 2 people. It might be slower, but everybody knows like how to do that. And that gets rid of that anxiety of like, oh, we don't have an MA, or because we all can do those things as long as they learn it. So that's kind of my mission, is they know all the 3 positions, they help each other out, and they're a great team. And then pretty much I just take them out like once a month. We go out somewhere to eat or go out somewhere to hang out. It's on the clinic. If it's their birthdays, we try to do something for that. So I just try to keep that environment going. I was telling them, hey, look, I'm the doctor here. When I'm the doctor, I'm like, we're like coworkers. And then if I'm the boss or CEO type of thing, then, you know, that's a different thing. So, and then if we're out of the clinic, we're just hanging out, you know, and, you know, it's good when you can build those relationships like that, you know, and they're responsible, because I only work half days. So I don't work full days. And they're there half the day, and they take care of all the referrals, and they take care of anything else that has to be done in the clinic. And then I'm off like Sunday, Mondays. So they clean the clinic, they do all that stuff. So they're full time. So yeah, for my staff, I think that's the biggest thing. And then Ramel, he started off with me like as my homie. He's like, he wasn't even charging me nothing, you know. I'm like, nah, dude, like we're doing good now. Like, charge me some money just so you can spend on your kids. But, you know, so it's been really cool, man. Just been surrounded by people that want to see you win, and you want to see them win. I think that's the recipe for something to do really good, you know?
Awesome. And when you talk about the culture, I love how you've built in making people feel valued, which is very hard to do in fee-for-service. Like you've explained, it's not even just fee-for-service, it's big corporations that can make a person feel like they don't actually matter, that they're just a number or a warm body. But I want to ask, when you do have times when you have to correct behavior or change a workflow, change like the execution of a workflow, how do you approach that, given how you just shared how you have like this is me when we're out once a month, this is me when we're at the clinic, this is me when I'm wearing the CEO hat. How do you piece out that part about correcting an employee's actions?
I think, everybody makes mistakes, or we all have our personalities. So your goal is not to make that look as a weakness, but to show them how can we improve that, right? We all can improve. So yeah, so I just talked to them about, hey, for example, my wife, shout out to my wife, man, like, thank you for always being there for me and help me out. I don't want to forget to say that, because I know she's going to listen to this and I don't give her enough credit. But yeah, she's the one that she does more of that part of it. So she says she's like the bad guy sometimes. But I also do it too. And what we try to do is just talk to them about like the why. So for example, like my wife, she worked at a dental office before. So she picked up some of the things for the phone. So, you know, anybody calls the office like, oh, when's the last time you were at our office? Because then you're picking up, is this a new patient or old patient? So we try to teach them that, so that if they don't say, and if they say like, something different, then we try to explain to them the why. But anything that goes bad, we usually just try to find the right time, like after work or early or whatever, where not nobody else around. And then just to talk to them, hey, or express what's going on, and then maybe how can we improve it? And if somebody is not doing it, then you're asking like, okay, maybe I'm the one that's not teaching right. I always look at that first. And then, or maybe there's something going on in their life, right? Some people are carrying some heavy things in their life, and you never want to put that off the table. So if you relate that, if that's the case, they'll usually fall through. But yeah, you just treat them like people. I think you talk to them, and like I said, they're all adults. They all know what to do. Even though I have an office manager, his role is just assigned like, hey, we got a referral. You take care of that. I'll take care of this. And he's never like, you do this, you do. It's like, hey, I'm gonna take this. You take this, and everything gets done. I always ask you, how's everything going? You guys doing good? You guys need more help? Now, Dr. B, we're doing good, man. We got everything caught up. Because I'm always thinking like, at one point we're gonna need another. Maybe somebody else to help, or maybe they don't have time to clean the office anymore. I think if we hire somebody else to come on, then, it's going to be somebody else cleaning the office, because my goal is to give them hours, right? And that's what they want. They need the hours, they want their time. So that's my goal. So I say, I could give it to somebody else, but then I'm going to cut you guys short. Like that's not what you guys want. So they're like, no, and they don't mind. They love the office, and they all work together. And that's something that's just, it's like a relationship, it's like getting married. Like, that just happens naturally. Sometimes you got good groups and sometimes you don't. And I got lucky that they're a really good group, but they're all young. So I want them to see them, if they stay with me and that's what they love, and I'll keep them helping them as much as I can. But if one day they decide to do something different, I want to be supportive, and then bring somebody else onto the team that hopefully will be good chemistry, So I think that's my goal, is always trying to look out for them. Even though they're great, you're like, oh man, that would suck if one of them left. But I want to see the best for them too. Yeah.
Awesome. And in terms of when you mentioned your wife, Carla is doing the aesthetics branch of your practice. So can you share about how that works in terms of your space? Does she have a separate space that she practices in? How does that work in terms of the aesthetics branch of your practice?
Yeah, so I think we have a video somewhere where we kind of check out like the practice and stuff, but we have 4 rooms. 3 rooms are primary care, and that's kind of what I focus on. And then there's a back area that's the aesthetics. And it's really nice. There's like a desk and some chairs where they can talk to Carla and express kind of, hey, well, this is kind of what's going on. She can explain to them like Botox, and because a lot of people sometimes they get the wrong impression. Like, if you have wrinkles, that doesn't take them away. It's to get them earlier before, so you don't get those wrinkles, right? So giving a lot of patients like what the product does, how it works, giving them expectations, all those things. And she loves aesthetics. So she is a nurse, and she worked in the floor, and she loves patients too. She's always pulling on the rope, like, oh, I want to go back to the hospital because I love helping patients there too. But then I think she wants to do nurse practitioner to, see patients with me in the office, because she has her bachelor's in nursing. So she's like right there to just jump on that. But we have 2 little kids and one on the way. So she's the one that keeps everything balanced. She always, from the beginning, she's the one that says, keep this balance. Don't start overworking. Don't go back to the old days when you were working balance it out. So that's what we do. She does aesthetics. So for coming from her passion, she went to, she always had a passion for it. She met a nurse that did a lot of the aesthetic procedures that worked in the surgical floor, but she did that on the side, and she got interested in it. So she went to Beverly Hills and did the training to do all the procedures. She does a lot of the lip fillers and fillers for the cheeks, training for the Botox, chemical peels. We do PRP for a lot of the scarring on the skin, and I do a lot for the joints, but she helps me draw the blood and get all that ready. So she really liked that. So she got training. And then what we did is the whole DPC thing was, let's balance out our family life with what our mission is in life, right? With our career. So what we did is, once I quit my job, I took off Sundays and Mondays, because people like those Saturdays. And there's a lot of people that sometimes don't have the weekdays because they go to work early in the morning and they get off really late, and the only way they could get in is on a Saturday. So I didn't want to take out that Saturday for my benefit, because I wanted the patients to have that there. But I only do a half day, so we do from 9 to 12. So the way our schedule works is, we're open Monday through Saturday. The clinic's open 9 to 5 and Saturdays 9 to 12, but the staff is there for the whole time. I have patients scheduled. I do alternate. So I do Tuesdays, let's say 9 to 12, because we're closed from 12 to 1 for lunch. And then I do another, like, let's say Wednesday, 1 to 5, and then we alternate that. And then the next week we do it the opposite, because in case somebody needs a Thursday morning or whatever, it's all there, right? And then Carla just works on Wednesdays and Fridays. So Carla goes in and she has her patient scheduled a half day on a Wednesday and then a half day on a Friday. So what happens is when I'm seeing patients, then I get off and then she'll go in and see her patients, and then the opposite. And then on Saturdays, I do 2 Saturdays a month, and then she does 1 Saturday a month. And then one of the weeks in the month, we work on Monday. I work on Monday. And then what I do is I take off that Friday, Saturday, Sunday, Monday. So we have a 4-day weekend on one of those weeks. And then it's 3 Saturdays a month we're there. I'm there 2 Saturdays, she's there 1. And then 1 Saturday, we'll have a Saturday off. So that's kind of how we balanced it out. And it's been great. Just half days works perfect. We see 3 patients an hour. That's the max that I put on there. If there's something serious or something that's like a UTI or something, sometimes I'll have them come in, get a UA, and tell, hey, okay, yeah, it looks positive, or a cut. I'll squeeze them in, before I leave. But we try to keep it 3 patients an hour. We try to get that going, and then they're triaging. The staff is triaging as they call in, and I'll see if they need to be seen sooner or not, if there is something going on. And if not, then sometimes when I get home, we call them purples, but it's like messages. And before I give them 48 hours to answer those messages, and then I go on there and I'll do either refills, or it's not like I could do it at the very end of the day or whenever whenever it fits in there. And that works out perfect. So it's not like I'm at the office all day. Yeah.
Gotcha. And with you sharing how you're approaching 800 patients at the time of this podcast, and you also have a third one on the way. Congratulations, by the way, on that.
Thanks.
And with you sharing as to how you guys have built balance into your schedule to not go back to the old ways, how are you guys planning in the short term? Because you mentioned if Carla becomes a nurse practitioner, or you have another nurse practitioner who comes on to cover you, that's not in the short term. So do you have a doctor covering you for paternity leave, or how are you guys future planning coverage of all of your patients when baby comes?
Yeah. So like I said, since we just do half days, Carla will take time off because aesthetics is not like an emergency type of thing. So she can kind of block out her schedule for a little bit, and just the patients will schedule. They'll let them know when the next appointment is. And for me, the goal is, I think I always say, man, it's kind of crazy how life works, but I wasn't thinking about bringing on anybody initially. But as things started to get busy, it was like perfect timing, because my brother's wife, her cousin, works at doctors as an ICU nurse. So he worked at ICU, and she did nurse practitioner school right now. She needed to do her hours. So she asked my brother's wife, hey, can I do my hours with Dr. Buenostro? So I met her, and I trust my gut. I'm like, she seems like a cool person, because that's the last thing I want is just, something bad come to the clinic. So she's been great, man. She's just a quick learner. She's all about helping underserved. A large part of our community is Hispanic, because I speak Spanish. So a lot of Spanish-speaking patients follow our clinic when it comes to primary care. And she's a DACA resident, so she's very passionate about helping the community. And it's kind of her background kind of fits with the culture of the clinic and stuff. So I've been teaching her. I went through initially shadowing, and then, what I try to do is go through how I break down before I go into the room, like what's going on with the patient, what I'm thinking, and my diagnosis. And then as the patient talks to you, how to do a differential and what's going to be your top differential going down, and then how you're going to work it up and what you could do to get something better while you're waiting, right? So you get results and stuff. And I taught her like that's the way I always kind of process my thinking. And she's picked up on it right away. And now as a student, she's seeing the patients, and the patients are having a good response. I always tell my checkout, hey, ask them how the experience was. Ask her how she's doing. It's always a good experience, So they come back and I say, oh, I saw you saw Iris. How was that? Oh, she's really good, doctor. She was really nice. She's kind of like you. Like, okay. So she kind of follows the thing, So I think she'd be a good fit. And that's my goal is, since we do the half days, it's like she'll do the other half. And then the goal is to try to fill those other half days. And then she would probably cover one of those Saturdays. So then I would have just one Saturday, and then she would have one. And then now you get rid of working 2 Saturdays. So then everything's kind of balanced out. And that's the idea, is just to grow it organically, and then help each other out. And that's what I want to do. So I think we got a plan in place, and she wants to come on. So actually this month we're going to sit down, and I'm going to give her like an offer. So that way, if she says, yeah, this sounds good, then when she's done, then she'll right away have like a job. So she knows kind of where she'll be going. So that's kind of my position on it in regards to my practice. And now that I have DPC, that's what I'm seeing. I'm seeing my future is, if I could get it to the point where I get it really dialed in, then I would love like another doctor that wants to be somewhere else in Merced, Stockton, wherever, and say, hey, I'll help you build it out. I'll help you with all the stuff that is hard for us to do. Like I have, like Gio can go and build it out. Like when it comes to flooring, all that stuff out. And then I have Ramel can do all the payroll and help you get everything lined up so you don't have to worry about that. And then just get all the right team. And I have a formula for that. And then we can get all that. So you can just focus on medicine. But what I'm thinking is like investing, right? So if we invest 50-50, then I'll be half partner, you be half partner, and then you get paid as a doctor. But then if you do good, then we all win. So that's kind of my vision for the future, because I'm all about like the way you see DPC, it has to grow. So if nobody jumps into it, we're never going to grow, right? So I'm kind of looking into how can I help other people grow, and maybe showing them, hey, look, I did it. Let me show you all my numbers and how it looks, how I kept my half days. So you have your balance. Like we actually went to a birthday party in Fresno with one of my co-residents the other day. I was talking to a lot of my buddies because they're out there, and you only work a half day? What? And you're making as much money as you were when you were working? What? And you only see 3 patients an hour? What? And they're just like, how can I do this? I'm like, I'll help you out, man. Like, you want to do it, let me know, And I don't have to be a part. I mean, I'll help somebody out. They just want to do it. But I feel like that's the part that's missing, because that's the part that, I mean, it was scary for me. But I got lucky that all these things have lined up, and it's going to be a win-win for the people that are going to be involved in it. So that's kind of my hopefully long-term kind of vision, in the next, maybe I have a 5-year lease, and that was my goal. In these 5 years, I'm going to find out if I could either keep growing this or just stay where I'm at, or decide kind of what I want to do,
And when you talk about training and bringing in more people and growing Buen Vita, have you had residents shadow at your clinic as well?
Not yet, but like at UCSF, they have a community rotation, and every time they have them call me and ask like, hey, what's DPC, or what are you doing? Because they're supposed to connect with different residents and find out what they're doing out there. So, a lot of them like didn't know anything about it. So I think that if I, just like Iris came on and she just like fell in love with the way things are going at the office, and I think she likes it. I think she really likes it, and she's a good fit. I love to get more residents like that if it's the right fit, because it's not about just working half days. It's about loving what you're doing. You know what I mean? And then it's a win-win from every angle. So that's kind of what I'm looking for. And if it's the right partner out there, then I'd love to have a doctor, because I feel like that's the only way you're going to have success, is if the person that's in the clinic loves the clinic and is passionate about the clinic and the employees, and it doesn't become like everything else, like in the States, that is just like nobody owns any of it. So you get there and nobody gives a shit. I want it to be where somebody's there and they care about what's going on. So that's the only way I kind of picture in my head. And then there's a saying, put your money where your mouth is. So if we're going to open up a practice somewhere and take that risk, it's a win-win, right? I think a lot of people that are into this, sometimes like entrepreneurs, so like people invest into houses to get the return on their investment into this. Like, why not invest into yourself? Like, that's the best bet, right? So I'm like, if I believe in this doctor, well, I want to help him out, but then he needs to be there to make sure everything takes care of it, right? So like my home base is Turlock, and I'll take care of that. And somebody else's home base can be somewhere else. They can take care of that, but we can invest into that and win. That's my vision for this thing for the future, I think, for it to grow.
Awesome. And yeah, I think that really, at the end of the day, always highlights how we are relationship-based doctors, in terms of we have a relationship with our community. You are absolutely crushing that goal that you had with an open door policy and being able to serve anybody wherever they needed help. But so when we think of that space of loving your practice, and we also go back to that spot that you were in where you were like, I want to open my private practice, but I didn't really know if it was going to be DPC or another model. What words of wisdom do you have, in addition to what you've shared, for those people who might be in a place where, gosh, like I really want to do this, but I have some hesitancies about finances or space or whatever it might be? What additional words of wisdom would you have to share with those people?
Yeah. I mean, I feel like the story of my mom is the one that I followed, is never put your family at risk. That's something you don't want to do. I mean, we always talk about it. You hear the DPC story, somebody was doing locums or different things. Find out how to make it work, but where you're going to be, the best time you're going to be putting it into what you really want, right? So for me, I was lucky that where I was practicing, I had the upper hand to say, hey, I'm going to work 12s and I'm going to work these days. And that's it. If you like it or not, that's what I'm going to do it. And that's what always my belief was, to have that, right? So you gotta, as doctors, we have to define what we want, man. We have the upper hand. We put in the work. So nobody should that's why for me, sorry if I don't offend anybody, Kaiser, Sutter, whatever, that's what they have. They have control. They tell you when to work, how many hours you could work, and then all these emails you have to answer. And it's kind of like, okay, well, where's your autonomy? So for me, it's like, don't forget your autonomy, and then set your goals on what you want in your life with your family. Like, your time is the most valuable thing. When I first started, I just wanted to work and I wanted to kind of get out there. And now it's like, I want to have my time, and I read a lot of books, and a lot of books talk about that. Just the most valuable thing you have is your time. So I think as doctors, you can practice good quality medicine and have time. And I think, to me, that's what I want to offer in the future, is say, hey, I can help you be the doctor you want to be and have the time and all that lined up together. So just figure out how to keep on working. It's going to be a grind for a little bit, maybe, but also how to invest into yourself and your future. And that's the only way you could do it sometimes, is you have to have 2 jobs for a little bit. But then once you unlock, then you're free. You got so much more. I take my kids to school every day. If it's not me, it's my wife. We don't have any babysitters, because if I'm working, she's not. And if she's working, I'm not. So it's like, man, you only got kids for a little while, especially if you have kids. Like, do everything you can to make sure you don't lose that. Because that's one thing that my mom always said, is like, she's like, man, I always regret that I had to work so hard and I lost all that time with you guys. But I'm like, Mom, you don't even know how much I learned from what you did. You know what I mean? So I'm grateful for what you did. Like, honestly, I have no regrets. But every story, there's always something behind there. And that's what I think for my kids. Like, what can I give to my kids too as they get older, where they're not like feeling like a silver spoon in the mouth. And I'm very humble, down to earth type of dude, that I love to hard work. And that's the kind of people I like to surround myself around. And that's why I think that's the key. Surround yourself around people like that, and you're going to win, man. I talk about Romel, I talk about Gio, the staff, Nacho, my wife, they're all like part of the team, and I feel so blessed. I feel so blessed, and sometimes it gets emotional, like, dang, how'd I get this lucky,
I love it. And I hope that everyone is as lucky as you are on their journey. You've shared so many amazing stories and words of wisdom, but I want to ask in closing, do you have any other words of wisdom that you'd like to share with the audience?
For me, I think the best words of wisdom is, we only have one life, so don't waste it. Really take advantage of it. And that means go out and reach for your dream. And some people, it is just something simple, having a job, and that's a blessing, and having the things you want. But when you have a dream and you want it, just go out and do it, because you don't want to look back and go, dang, why didn't I do that? Don't regrets. Just go out and do it, and surround yourself with good people, and it'll come true. If you put in the work, and even when things don't come true or don't happen, they're supposed to, because then they do happen down the road. Sometimes out of something bad comes something good. That's the only way I could put it. Sometimes things that seem bad are good. So even sometimes when you're like, just keep reaching for what you want and you'll get it. And even if it's not happens like in a straight line, you'll curve around it and you'll come to it. So that's the only thing I can say. Just reach for your dreams. So far, everything I've wanted to do has come true. So that's all I can tell you, man. Just reach for your dreams and take care of people. Don't forget that we're here to serve people. And I think that's the main thing. It's not only patients, but if you do a DPC, your employees, if you do good, your family and your kids, and just as long as you do that, you're going to be happy. They say money doesn't buy happiness until you start giving it away. Until you start doing stuff with it that's good, then it brings all the happiness in the world. So that's all I can say, man. Right now, I feel so emotional because it's been good.
It's beautiful. It's beautiful. So thank you so much, Dr. Buenostro, for joining us today.
Thank you. I appreciate you letting me share. And I want to say thanks one more time to everybody that helped me get here. And thank you for doing what you're doing. I think it's bringing awareness. And not only that, but it's so cool to hear everybody's story. I think everybody's story is unique. And thank you for doing this and putting in the time. And I appreciate that. Thank you.
Next week, look forward to hearing from the triple threat of Dr. Leslie Surbeck, Dr. Sherry Vang, and Dr. Anita McDonald of Evergreen Primary Care in St. Paul, Minnesota. I'm Dr. Clodagh Ryan, of Cara Direct Care in LaGrange, Illinois, and I get to read the credits this week. Keep listening for more of my Irish accent. If you've enjoyed the podcast and you haven't yet done so, subscribe today and share the episode with a physician you may know who needs to hear about DPC. Leave a 5-star review on Apple Podcasts and on Spotify as well, as it helps others to find all these DPC stories. Lastly, be sure to follow us on social media. If you're wanting to continue to learn more about DPC, check out dpcnews.com. Bye! Slán go fóill!